Obama's healthcare reform solution, a technical explanation including pH balance and the key to lower healthcare costs. Part 2 of 3. Normal blood pH is assumed to be acidic. Most people have acidic blood with a pH of less than 7, and it is assumed this is normal. But because they have a healthy system, this unbalanced body chemistry can be tolerated by the system, but the actual control point is 7.365, and in time the system will wear down and then sickness and disease will set in. The problem is, because of the resilience of the human body, sometimes this can take decades and is different for different people. So proving this point will be difficult. Because most of our muscles and organs and bones maintain a pH of 7.365, it is assumed the true bodily control point is 7.365. The FDA protects the interest of companies first and the consumer second. Eating healthy and maintaining a pH of the blood of 7.365 simplifies healthcare and the food system, but could eventually eliminate hundreds of thousands of jobs in the food and healthcare industries. If the naysayers say that healthcare cannot be this simple, I say prove it. By making healthcare complicated, it increases the value and thus the cost attached to healthcare. Anyone who has ever tested the chemistry of a swimming pool knows a sick pool is an acidic pool. Most nutritional products are helpful in preventing disease and sickness and counter free radicals by adding antioxidants to the human body, which tries to increase the pH of the blood to above 7. Desired blood and body pH of 7.365. If it is ever found that maintaining the pH of the blood at 7.365 prevented cancer and other diseases, then the need for whole sections of the health care system and research programs would eventually become unnecessary. If it is ever found that there is a relationship between blood chemistry or pH, then one would just need nutritional food and supplements to raise the pH to 7.365 or above. Knowing how the body actually cures itself is no longer a concern. All that is now necessary is to balance the pH. The best part is most nutritional supplements have no side effects, even in large doses. Part of the efficacy testing would include the determination of the recommended minimum dosage. The value of eating fresh fruits and vegetables. Extensive testing needs to be done on the value of eating fresh fruits and vegetables on a regular basis and how it prevents disease. It may be found that whole areas of the food system would eventually become unwanted and unnecessary. The quantifying of the efficacy of fresh fruits and vegetables is paramount before any valid testing can be done. The challenge is getting truly fresh picked produce of a consistent chemistry. Chemistry can change with different soil conditions and weather conditions, and then when the produce is picked, will also affect the chemistry. All of this can affect nutritional value. Most fruits and vegetables are seasonally picked before they are ripened and thus lose much of their nutritional value while being stored in nitrogen, and in most cases are shipped great distances from where the produce is in season. This is why nutritional supplements are so important, because in most cases fresh picked is impossible for most people.